Imagine your brain sending a perfectly clear command. Lift your hand, take a step, say a word. Simple, right? Now imagine the wire carrying that signal is, well, it's fraying, and the message just gets lost somewhere along the way. That, right there, is the heart of what we're exploring today. A signal interrupted.
And that question, that really gets to the core of this profound and incredibly challenging human experience. It's the story of a mind that's still sharp, it's aware, it's full of intention, but it's trapped inside a body that is slowly, progressively losing its ability to respond.
So to understand this communication breakdown, we have to meet the messengers themselves. These are the motor neurons. Just think of them as the electrical wiring of your body. They faithfully carry every single command from your brain's headquarters out to the muscles on the front lines, telling them exactly when and how to move.
But when these specific messengers, these motor neurons, begin to break down and die, that connection is lost. The muscles just don't get their commands anymore. And this progressive neurodegenerative disorder, that's what we know as amyotrophic lateral sclerosis, or ALS.
Okay, so let's break down that name for a second, because it sounds really intimidating, but it actually tells us the whole story. Amyotrophic is just Greek for without muscle nourishment, which points to the muscle wasting or atrophy that happens. Lateral tells us the specific area in the spinal cord where these nerve fibers are getting damaged. And sclerosis? That simply means scarring or hardening, which is what's left behind after those neurons degenerate. See? It's all right there in the name.
And this brings us to what is really the central paradox of ALS. It's not just one type of wire that fails, it's actually two completely distinct types, and the way they fail creates a set of symptoms that seem to totally contradict each other.
Okay, so this is where that paradox really comes into play. You've got your upper motor neurons, which start up in the brain. When they fail, muscles get tight, stiff, and reflexes become super hyperactive. But then you've got your lower motor neurons running from the spinal cord out to the muscles. When they fail, you get the total opposite. Weakness, muscle wasting, and those little twitches called fasciculations. What makes ALS so unique is that it hits both of these, often at the exact same time.
So, this bizarre combination of contradictory signs, stiffness from the upper neurons and weakness from the lower ones, sometimes in the very same limb, that is the absolute defining hallmark of ALS. It's the key clue that points neurologists toward this specific diagnosis.
Now, this isn't a condition that just shows up all at once. It's a progressive journey, as that signal loss, slowly and relentlessly, spreads through the body's entire communication network.
So how does this journey usually unfold? Well, it typically starts asymmetrically. Maybe some weakness or twitching in just one hand or one leg. From there, it gradually starts to spread. Eventually, it can get to the bulbar muscles, the ones that control speech and swallowing, making it really tough to talk and eat. And the final, most critical stage is when it impacts the respiratory muscles, like the diaphragm, which ultimately leads to breathing failure.
This always raises a really common question. Where does ALS even come from? And the truth is, for the vast majority, we're talking 90 to 95% of all cases, the cause is sporadic. That means it just seems to appear randomly with no known reason. Only a very small fraction, about 5 to 10%, is familial, meaning it's passed down through a family's genes.
And that brings us to the really harsh reality of this disease's progression. The median survival time from when symptoms first start is just 3 to 5 years. And that number, more than anything, highlights how urgent diagnosis and supportive care really are.
So how in the world do doctors arrive at such a life-altering diagnosis? It's definitely not a simple blood test. No, it's a meticulous process of investigation, a real search for a definitive answer.
And this is a totally fair question. If you have that really unique combination of upper and lower motor neuron signs, why isn't the diagnosis just immediate? Why is it so hard?
Well, the answer is that there is no single test for ALS. Instead, it's what's called a clinical diagnosis of exclusion. Doctors have to play detective and rule out a whole list of other conditions that can look a lot like it, everything from multiple sclerosis to nerve compression in the neck. So once all those other conditions are off the table, neurologists turn to a set of guidelines called the El-Escorial criteria. This basically just formalizes the process. It requires clear-cut evidence of both upper and lower motor neuron degeneration and proof that the symptoms are spreading and getting worse over time.
With a diagnosis finally confirmed, the whole focus shifts dramatically. Since there is no cure, the battle becomes something else. It becomes a fight for every ounce of function, every bit of independence, and for quality of life.
Now, there are a couple of disease-modifying drugs out there. Riluzole can extend survival by a few months, and edaravone might slow down the decline for some people. But while these are definitely important, they're really just one small piece of a much, much bigger management puzzle.
And that's the crucial point, right there. The most significant, meaningful impact on a patient's life doesn't come from a pill. It comes from a dedicated, multidisciplinary team all working together.
And this is that team. You've got physiotherapists working to keep people mobile, respiratory specialists providing non-invasive ventilation, like a BiPAP machine, which is proven to significantly improve both survival and comfort. You have therapists providing amazing tools for communication and daily living, and nutritionists making sure the body gets the fuel it needs to keep fighting. Every single one of these pillars is absolutely essential.
And really, this quote says it all. Getting this team involved early on doesn't just make life better, it can actually extend it. It's all about proactively managing symptoms and empowering the person, not just treating a disease.
Which leaves us with a final thought to chew on. ALS is a disease of disconnection, a failure of the body's internal wiring. But the response to it, the therapy, the support, the technology, the care, all of it is about connection. And it raises a really important question. When the physical signals are interrupted, maybe the most vital work we can possibly do is to reinforce and strengthen the human ones.